Research shows that a quarter of all households actually benefit from the pension. Research from Lesotho again shows that when poor people receive cash, they tend to spend it on food and other necessities such as healthcare. The examples from Lesotho, Mozambique, and Zambia illustrate that social transfers are effective in assisting the poor and vulnerable. But does the evidence from these countries address the most common criticisms of social transfers, and cash transfers in particular?
The evidence from case studies of social transfer programs across Africa is overwhelmingly positive. Firstly, of course, if you give poor people money, they are better off. So their income rises and their poverty level reduces. Often people invest some of this money. They don't just consume it, although that's important. They meet their basic needs. They buy food and groceries and clothing and so on. But they also invest some of this money in education for their children, or in their own health, or in farming. They buy seeds and fertilizer. So poverty levels can reduce both directly and indirectly. We find evidence, for example, that where you've got very big social pension schemes, as in South Africa, that children in households where there is a pensioner are actually taller than children who don't have pensioners supporting them.
One really important study shows that it raises where the pension goes to an older woman, and there's a huge big gender difference there. Where the pension goes to an older woman, it raises the nutritional status as measured, the nutritional state of household members. So it's not saying that old people saying we give it to the family. It's actually measured nutritional status, and particularly of young children, which is important.
We find that there is very powerful evidence that cash transfers in particular generate economic multipliers.
People are taking these grants and they're buying something with these grants, and then they sell that thing. And then they translate a 700 or 800 grant to 12 or 13 or 1400.
And this economic multiplier effect has benefits for trade and for employment and for income generation throughout the economy. So you can imagine that if you multiply that up, if you have a large-scale program over the entire economy running for a long time, that you're going to get economic growth impacts, and the evidence for this is starting to build up, and that over time, eventually, less people would be in poverty, less people would need social protection, and so the government would need to spend less on social protection in the long run than it does have to do initially.
There are two crucial questions to be resolved. Who should benefit from social transfer programs, and how will governments pay for them?
Targeting is one of the longest-running debates in social protection. Should we give social transfers to the poorest of the poor, or to vulnerable groups who are identifiably vulnerable because they are old or very young, or they have a disability, or they're chronically ill? It's very difficult to identify who the poorest of the poor actually are, especially if you're talking about communities where there's widespread poverty. If instead you were to identify groups of people who are clearly vulnerable and that the community accepts as being vulnerable, and you target your transfers at those groups, you're more likely to get a big impact because it's going to be well targeted, and also you're going to get more social acceptance of that targeting criterion. So pensions to the older person are a very popular and deservedly so form of targeting. Similarly, providing child support grants or support to young children or people who are chronically ill. These are categories of people that everybody accepts are vulnerable. The question of whether social protection is affordable or not is often raised, but this is really a political choice rather than a technical one. Governments can choose how to spend their money, and they do. If they choose to prioritize social protection, they'll go ahead and do it.
Shouldn't we not be simply thinking about how to pay for it? Shouldn't we be thinking about how to rechange the spending priorities of the state?
It's not true that governments cannot afford social protection. we can cut down on unnecessary expenditures and take care of the poor. And then, only then, that day, we will say we have joined the global race.
As the saying goes, where there's a will, there's a way. Despite all the positive evidence, some governments are reluctant to begin implementing social protection. In such cases, ordinary citizens and civil society organizations have an important role to play in persuading policymakers that social transfers are a priority. In other words, in building political will for social protection.
Do we want to? That's the question. It's not about resources, it's about the willpower. Do we want to?
Once the government has committed to introduce some form of social protection, it's very difficult to reverse that. And it becomes something that civil society can mobilize around. For instance, in Lesotho, we are now seeing efforts to lower the age of eligibility from 70 down to 65 or 60. In South Africa, the Child Support Grant is the subject of a campaign to raise the age from 14 to 16 and then later on to 18.
What works is we start with debates. We start with a lot of media. You expose the thing and exactly how, why we need social protection. You then start making petitions. You can even jump petitions to demonstrations. You mobilize the community into fighting for their rights. Because if they don't, what will happen? Something comes up from the blues, like xenophobia. When the poor have had enough, they can do anything.
With poverty making headlines and world leaders worried about the link between hunger and social instability, perhaps the real question facing us all is not whether social protection is affordable, but rather, what is the cost of not putting social protection programs in place?
Prevention may look expensive, but believe it, it's much cheaper than actually having to deal with catastrophes.
If you actually do not do this, there are some serious consequences to that. We can have the most wonderful initiatives, but we might have serious disruptions at the political level that destroy all our futures. And that's something that we need to start thinking about.
In Africa, it seems we're not yet convinced. And so we're endlessly running new pilots to try and find more lessons that we can learn, when in fact the lessons are there and they're very clear and they're unambiguously positive. So I think although pilots have had a very big impact in terms of telling us how to do social protection well, it's time to move away from pilots and to move up to the next challenge, which is nationally run, government-owned, citizen-driven social protection.
I would really request that the government continues to run a program like this, because people like me are really poor and we have no means of survival, and the children that we are keeping need to go to school.
Social protection imateteza magulu asakwere mbuna ya umpawi. Social protection kupata antu inumpawu zoti azitetezere. Social protection kupata antu inumpawu zokonyeza umpawi wawo. Social protection imayanganira magulu antu sauka. Social protection imateteza magulu asakwere mbuna ya umpawi. Social protection kupata antu inumpawu zoti azitetezere. Social protection kupata antu inumpawu zokonyeza umpawi wawo. Social protection imayanganira magulu antu sauka. Social protection imateteza